First off, there's a couple disclaimers. If you don't have time to watch the video or you just don't want to, there is a TLDW comment pinned right below this video that kind of goes into some details about it if you just want the gist. A second disclaimer is that we're going to be talking about surgical procedures and symptoms of illnesses and things like that. So I get it. I totally get if you don't want to see that or sit through that. I get it. My name is the Lost Narrator, or some of you guys call me Lost. I've been called Losty. I have been making YouTube videos on this channel for the last almost 12 years now. I'm known for making pony fanfic audio adaptations and bloopers, and I make content. I make creative content for the internet. That's what I do. But today I'm coming to you as Larissa. I'm coming to you as Larissa because I'm in a tough spot right now. But I do want to explain this situation just a little bit. 9 years ago, I was rushed to the emergency room because I was in a lot of pain, and I was basically diagnosed, or they found out that I had a basketball-sized cyst in my right fallopian tube. I had to have emergency surgery, and it was pretty bad. But because of the fandom, I was able to basically get through it. The brony fandom specifically. If you want more details on that as well, there is a Google Doc in the description that you can check out and read. It has pictures of the actual cyst, so there's another trigger warning right there. It was after I got the cyst removed, I was feeling a lot better. Before the cyst had been removed, I was dealing with a lot of issues, but once I had the surgery and I got past the recovery for it, I was pretty good, and I thought I was done dealing with it. I thought I was done dealing with it. And, but that's not the case anymore. After the cyst was removed, I was diagnosed by my doctor with PCOS, which is polycystic ovary syndrome. I always get that wrong. I was diagnosed with that. I was getting treatment for it. I was on medication for it. I was trying to regulate it as best as I could, and only the right fallopian tube was removed. So I got to keep everything else. We were good. We were good at that point. But in 2024, I started dealing with back pain, and I wrote it off. I assumed it was old age. I mean, I'm not that fucking old. I'm only 38. But I assumed it was just, my lifestyle. I work from home. I'm not necessarily the most active. I know. We get it. Okay. But I just assumed it was that. But as the year went on, I was starting to deal with more and more things. And it wasn't until April of 2025 that it reached an apex, where one day I woke up and I was in probably some of the most excruciating pain that I had ever been in. I usually gauge my pain between a 1, because, when you go to the doctor, they ask, what's your pain, between a 1 to a 10? And I was at a 9. I was at a 9 to a 10. And yeah, you know what? I should have gone to the emergency room then, but insurance is a bitch, and finances are not necessarily the best for me right now. So I waited it out, and my wife, Mag, or Magpie Pony, as you guys know her, she made an appointment to my OBGYN, and I went in to go get checked out because it was in my pelvic area. And we did an ultrasound, and that first ultrasound, they found a mass. They didn't know what that mass was yet, but they were like, it's a mass. And the doctor submitted for me to get a CT scan, which my insurance denied. Don't know why the fuck they denied it, but they denied it. So what the fuck ever. Another month went by, and my doctor said, come back in. We'll figure it out. I'm going to work with you. And she did another ultrasound. And that's when they found the mass again, but it had gotten bigger. That's when she ordered for me to get an MRI and blood work done to see if it was cancer. Luckily, it wasn't cancer, but I spiraled pretty bad for the month of April and May because of waiting for the results and just I have history of ovarian cancer on both sides of my family. So I take this very seriously. I don't mess around with these sorts of things. Your girl spiraled because I was scared because I know this sounds weird, but I can handle surgeries. I've had surgeries my whole life. I've had like surgeries with my ankle. I've had other types of surgeries, but like knowing that it might or could have been cancer threw me for a loop. But luckily it wasn't. But then we got the MRI scans. And that's when we realized just how bad everything was. So the results. The doctor said that I have three fibroids on my uterus. I have one pedunculated fibroid that's outside of my uterus. That's described as the size of a baby's head. When I told Goody Serenade this, he made the joke of, oh, you should bust out your baseball mitts because now you don't have to play basketball. Now you can play softball. Yeah, I gotta make jokes here, you guys, because if I can't joke about this, I'm gonna lose my shit. That mass, unfortunately, though, is shoving into my uterus and my lower intestine, and it's causing me very, 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 very severe back pain that there's no medicine that makes it go away. I've been taking ibuprofen. I've been taking Tylenol. They gave me the hard prescription stuff, opioids. That's not working either. Nothing is making the pain go away. The only way to make the pain go away is to get a hysterectomy. Luckily, the insurance did approve me for that. I am getting a hysterectomy on Tuesday, July 22nd, which is literally a month after my birthday. So I don't know how to feel about that. And when this video goes up and when you guys are watching this, I'm going to be in surgery. I'm putting it up now because I don't want to have to deal with the anxiety of the internet. Because after this video goes up, I'm going to basically be taking a step away from YouTube for a little bit. And no, that does not mean that content is ending. I know you guys are so excited for the content that I make, and it brings me so much joy that you guys love my content that much, okay? Like, you don't even know how much that means to me. But the problem is that I can't work. Out of the 7 days of the week, 3 to 4 of those, I'm in bed in excruciating pain because I can't cope. And it's been like that since April consistently, but like I was still dealing with back pain, even in 2024. Like it's been there. And getting back on topic, hysterectomy. So, in case you're wondering what that means, they're going to be taking my left fallopian tube, because that's what's left, my uterus, and my cervix. And the doctor hopes that she can leave my ovaries. I don't know if they're going to be left, because that's the problem with this surgery. The biggest issue right now with the surgery is that because I had a previous surgery 9 years ago, there's a lot of scar tissue. And the doctor said it's either one of 2 different surgeries that I could potentially get. One where they make 4 little incisions with a robot and they pull it out and it's the end of the day and I get outpatient surgery, which that's wonderful. Or it's my life becomes a horror story. They have to cut me open and they got to get it out that way. And then I'm in the hospital for about 3 to 5 days, maybe even a week, depending on like complications and stuff like that. And I hate, fuck, I promised I wasn't going to cry. I hate that uncertainty because I don't like living with that sort of uncertainty because especially this year, I promised myself this year that I was going to work my ass off and get like back on my feet, like just overall in general with content and everything. But that has not been the case since the beginning of this fucking year. It really hasn't. And now with this, I'm just like, whoo boy. I'm already kind of anticipating the worst surgery because there's a lot of scar tissue. And the past surgery and stuff like that. I don't know. Maybe by the will of God, I will not have to deal with that. But who knows? I know a lot of you guys have been waiting for content. I'm sorry. I'm really sorry that I haven't been able to get the content out as fast as I could, especially like with other sorts of productions too, because we have like the 2 infection AUs going on and like a bunch of other things. But like, I just want to get better. I just really want to get better, and I need to step away from YouTube for a little bit so that I can focus on myself. And that's why I'm making this video, because, well, to be honest, my wife and I, we can't financially afford this right now. I can't. Like, this is going to leave a crater financially. Originally, I was looking into getting a job back in 2024, and that didn't mean I was going to stop YouTube. I wanted to work on the side, but then I would work on YouTube in my free time, and I really, I've done that before, because I love this platform. I love the fact that I have the freedom to make things that you guys enjoy. Like, that, it blows my mind, but I can't do that if I'm in severe pain. I can't even sit at my desk for long periods of time because of the pain. This is going to really set me back, because the recovery time can vary. It could be like, the normal 6 weeks for a hysterectomy, or if there's major complications, it could take up to 2 months to 6 months. It really just depends on what happens. And there's a lot of uncertainty with it. And that's why I'm putting out, I'm asking for help. And that's a hard thing for me to do, because I don't like doing that. You guys come to me. You guys come to me for escape. And I like that I'm that for you. Okay? Even if it's horror. But I've always enjoyed the fact that we don't talk about what's going on in the real world. And I've always prided myself in that fact. But right now, I can't be that. I have to take care of myself. And to be honest, I need your guys' help. Mag has put together a GoFundMe for my medical expenses. It is a medical fund for my surgery and potential physical therapy that I'm going to need to have afterwards, because there's damage to my spine because of all of this shit. I don't know exactly what's gonna happen. I don't know the details yet. We still are kind of up in the air because I won't know until the surgery. If you relate to this, share it if you can't help. And even if you can't do anything, thoughts and prayers. I know people fucking shitpost that and people make fun of it, but you know what? I do believe in the power of prayer. Okay? I do. And I could really use that right now, because I don't want the eyes on me like this. I don't. The first time around, it was one of the most humbling things, but it was so overwhelming. And I've mentioned it before. I've been dealing with sensory issues lately, and I have horrible anxiety, and I have all these horrible things. And that's why I just want to make art. I just want to make art or silly Let's Plays where I shitpost. That's all I really want to do. But I can't do that right now because of how much pain I'm in. Because not even pain meds are working. They're not. And the only way I can get pain relief is with this surgery. If you can help, I would greatly appreciate it. And I do mean that. You guys have always been there for me. And it's because of you I've been able to grow as a content creator, and I've been able to do this as long as I have. But I'm terrified of the financial repercussions of this. I'm afraid because we're not doing okay. Like I said, that's why I was already looking for a job. And even after this, I want to still get a job. I don't want to have to worry about finances when I'm making my art. I don't. But yeah, I guess thank you for listening. Thank you for giving me your time, and I hope you have a wonderful day.